All right, sports fans, we're now going to discuss sports medicine. Injury to the rotator cuff, besides sidelining your favorite pitcher, is actually very common. It's essentially damage to the rotator cuff of muscles, the tendons, and the bursa all around the shoulder that leads to the inability to flex or abduct the shoulder. The presentation is actually very peculiar. It presents with pain in the shoulder that's worse at night when laying on the affected shoulder, not during actual usage of the shoulder. They may also complain of pain at the site of the insertion of supraspinatus. This is something you'll pick up on exam. MRI is the most accurate test for someone with a rotator cuff injury. You start them with NSAIDs, rest, and physical therapy. You proceed to steroids if they do not respond, and surgery is used with complete tears and those not responding to NSAIDs, steroids, and physical therapy. The cause of patellofemoral syndrome is essentially anterior knee pain secondary to a trauma, an imbalance of quadriceps strength, or simply a meniscal tear. It presents with pain in front of the knee or underneath the patella. It's worse when walking up or down stairs, and it's worse just after starting to walk after having been seated for a prolonged period of time. Ironically, though, it improves after walking. Patients with patellofemoral syndrome will present with crepitus, joint locking, and instability. If you get some x-rays, they're going to be normal. Most cases are not going to respond to physical therapy and strength training with cycling. Remember, knee braces don't help in this case because there's nothing to fix surgically. Plantar fasciitis presents with very severe pain in the bottom of your foot. It's near the calcaneus where the fascia inserts. Patients will typically say they feel like there's a tack in the bottom of their foot. It is of unclear etiology, but the pain is worse in the morning and improves with walking simply a few steps. There's also point tenderness at the bottom of the foot where the fascia inserts into the calcaneus. You can distinguish this from tarsal tunnel syndrome because the pain of that disorder worsens with use, and plantar fasciitis clearly improves with use. Now here's a patient with plantar fasciitis. It's a plain old x-ray. We don't recommend getting one because there's no real association between plantar fasciitis and heel spurs that you see here in the radiograph. The treatment consists of stretching exercises, arch supports, and NSAIDs. Steroid injection is performed if these don't solve the problem, but they usually do. Surgical release of the plantar fascia is rarely necessary. What you should keep in mind is that x-ray of the foot is not useful in plantar fasciitis. There is no correlation with the presence of heel spurs. We will now discuss osteoporosis. Look for an older person, more often a female, with vertebral fractures leading to a loss of height or wrist fractures. Asymptomatic fractures can be found on routine DEXA scans. We recommend DEXA scans for all women greater than 65. Osteoporosis will give you spontaneous fractures of the weight-bearing bones. This can help with diagnosis. The most accurate test is a bone densitometry, or DEXA scan. The T-score that's resulted from a DEXA compares bone density with the normal density of a young woman. There are two diagnoses. The first is osteopenia. This is a bone density with a T-score that's between 1 and 2.5 standard deviations below normal. Osteoporosis is a T-score more than 2.5 standard deviations below normal. All blood tests, including calcium, phosphate, and parathyroid hormone, are normal in osteoporosis. Vitamin D and calcium are the best initial therapy. Bisphosphonates are then used when the T-score is more than 2.5 standard deviations below normal. Estrogen replacement is especially useful in postmenopausal women, but it does have side effects. Raloxifene is then used as a substitute for estrogen in postmenopausal women. It also reduces the risk of breast cancer and decreases LDL levels. Teriparatide is an analog of PTH that stimulates new bone formation. That's one option for treatment. Another is used as a nasal spray. Calcitonin can also decrease vertebral fracture risk. Here's a little note for you. Bisphosphonates are very rarely associated with osteonecrosis of the jaw. It's just the news that sensationalizes this idea. Bisphosphonates that have prolonged contact with the esophagus can cause esophagitis. This is known as pill esophagitis. When you have a question about osteoporosis and multiple treatment options are presented, choose vitamin D, calcium, and then bisphosphonates. Teriparatide has caused osteosarcoma in rats. It can also cause hypercalcemia, so look out for these as two possible side effects of the medication.